Welcome to our channel. If you have a dental emergency, follow these step-by-step instructions to get prompt treatment and pain relief. Step 1. Assess the severity of your dental emergency. Severe pain, broken teeth, knocked out teeth, abscess, or uncontrolled bleeding require immediate professional attention. Step 2. Call your regular dentist first, even after hours. Many dental practices have emergency phone lines or answering services that can provide guidance or schedule urgent appointments. Step 3. Search for emergency dental clinics in your area. These facilities specialize in urgent dental care and often have extended hours, including evenings and weekends. Step 4. Visit a hospital emergency room for severe dental emergencies. Go to the ER if you have uncontrolled bleeding, severe swelling affecting breathing, or trauma with possible jaw fracture. Step 5. Contact dental schools in your area. Many have emergency clinics where supervised students provide care at significantly reduced costs. Step 6. Call 1-800-DENTIST or use online emergency dental locator services. These resources connect you with dentists offering same-day or emergency appointments near you. Step 7. For knocked out teeth, handle carefully by the crown, rinse gently, and try to reinsert it or keep it in milk. Seek dental care within 30 minutes for the best chance of saving the tooth. Step 8. Ask about payment options if you lack dental insurance. Many emergency dentists offer payment plans, accept medical credit cards like Care Credit, or provide sliding scale fees based on income. Don't forget to like this video and subscribe to our channel.